Good morning. My name is Sydney Patterson and I am a PACU nurse at Fairview Riverside. It's hard to believe that we're here facing this situation again. A reality, once again, hospitals are refusing to work with nurses at the bargaining table, especially when it comes to patient safety, protecting nursing staff, and ensuring a healthy, sustainable workplace for everybody. We've been at the bargaining table for 3 months. Nurses have brought forward serious proposals about affordable, accessible healthcare plans, safe staffing and protections against unsafe scheduling, the rising violence we face at work, and respect for the professional sacrifices we make every day. Leadership has refused to meaningfully engage in these issues. They've proposed taking away our long-standing, affordable healthcare plans and replacing them with high-cost options. The hospitals want to cap sick time at 48 hours per year with an overall bank of 80 hours. We're healthcare workers on the front lines, exposed to illness every day. We gown up, we glove up, we mask up, and still take our work home. Under their proposals, we'd be allowed only 4 hours of sick time per month to recover and take care of our families. The hospitals also want the power to unilaterally cancel our shifts and send us home. Nurses already voluntarily take low need days, with a cost savings to the hospital of over $13 million over the past 2.5 years. They've proposed cutting overtime pay when we stay past our scheduled shifts to help cover gaps. Instead of staffing safely, they want to rely on overworked nurses volunteering extra time for no additional compensation. Inside the hospital, conditions are deteriorating. Frustrated patients and families struggling to access care are directing their anger at us. Violence toward healthcare workers is rising at alarming rates, and we're left to absorb the impact. We've asked for duress buttons to call for help in emergencies. Leadership responded by demanding allowing the technology of those systems to monitor and track our every move, not to improve patient care, but to discipline us. After years of dedicated service, we're treated as data points. And now they've offered us a wage increase so small it doesn't even make up the cost of living. Another line item in their plan to cut costs and maximize revenue at the expense of patient care and worker well-being. These issues are serious, but what led to the strike authorization vote is not just the proposals themselves. It's the hospital leadership has engaged in unfair labor practices, including refusing to bargain in good faith, withholding information, and attempting to undermine our union rights. That is why nurses have voted to authorize our negotiating team to call a ULP strike. We don't take this step lightly. Nurses care deeply about our patients and our work. But when leadership violates the law, refuses to engage, and puts both patients and workers at risk, we have a duty to act. The vote is a message. We are serious, we are united, and we will take action if needed. Not just for ourselves, but for the patients who depend on safe and reliable care. Thank you.
All right. Hello, my name is Greta Stafer, and I'm a nurse at Children's Hospital in Minneapolis. I've proudly served as a nurse for almost 2 years now. We've been in negotiations with children's leadership since March. Today marks our 12th bargaining session. Nurses on our bargaining team do this work on their own time, unpaid, though our contract guarantees they receive credit toward benefits and seniority. This doesn't cost the hospital anything, yet children's management is refusing to credit this time, forcing nurses to either use vacation hours or pick up extra shifts. It feels like a deliberate effort to discourage participation in bargaining and punish nurses for standing up for our coworkers. We've brought thoughtful, solution-oriented proposals to the table, focused on safe staffing, nurse retention, and protecting patient care. Most have been ignored. Instead, Children's has proposed gutting our contract and cutting benefits. Children's used to be a place where nurses were proud to work, not just because of the impact we have on children's lives, but because we were respected. That's changing. As executives focus more on financial goals, nurses are expected to do more with less. But when we're short-staffed, it's our patients who pay the price. We've been told Children's is not interested in our safe staffing proposal. Instead, they've asked us to be more flexible. But we're not elastic. We're nurses. We stretch ourselves every day for our patients. But we have limits. If we keep bending under these conditions, we will break. In addition to the slow progress at the table, we've seen actions from management that we believe undermine the bargaining process. When nurses are told they must use personal time to prepare for negotiations, despite the protections in our contract, it sends a message that our voices are not welcome. These actions have led nurses to file unfair labor practice charges. It's not just about slow bargaining anymore. It's about how management is treating nurses who are trying to advocate for their patients and their coworkers. It's part of a pattern that shows a lack of respect for nurses' role in shaping our future of this hospital. That's why nurses at Children's Minneapolis, St. Paul, and Mercy campuses have voted to authorize an unfair labor practice strike. This was not a decision we made lightly. Nurses want to be at the bedside caring for patients. But when our ability to advocate is being threatened, we have to act. This vote sends a strong message. We are united, we are serious, and we are prepared to take action to defend our patients, our profession, and our contract. We're not asking for extras. We're asking to be heard. We are calling for the safe staffing, support, and respect it takes to deliver safe, ethical care. We need a meaningful voice in decisions that affect our work and our patients. We are the kid experts, and we're ready to do whatever it takes to win safe staffing and a fair contract.
Good morning. My name is Jess Besselman. I'm a nurse on the medical surgical oncology floor at Abbott, and I'm also a member of the Abbott negotiating team. We've now sat across the table from Alina 9 times during these contract negotiations. 9 times. And still, they refuse to meaningfully engage on several of our proposals, especially our staffing proposal, which directly impacts patient care and nurse well-being. We've poured our hearts out on those sessions, sharing the brutal reality of what it's like on the floor, the cuts, the chaos, and the care that's slipping through the cracks. We've given tearful testimony, we've been brutally honest, and still, Alina's leaders sit across from us, disinterested, dismissive, and unwilling to even have a conversation. Let me be real with you. This isn't just about feeling unheard. This is about the dangerous consequences of cost-cutting decisions made by our executives who've never stepped foot on our unit. We're being asked to do more with less, fewer resources, fewer nursing assistants, and less support for patients. We're burnt out, we're drowning in impossible workloads, and morally wrecked from having to deliver the bare minimum instead of the care that we've been trained to give. There are days when I'm in a patient's room trying to offer comfort to one of the worst moments of their life, a new cancer diagnosis, and I get pulled away by alarms, meds, or other emergencies down the hall. There's no backup, there's no relief, and there's no breaks. Just me trying to hold it all together. This is not sustainable. Nurses are leaving because this job has been made unbearable. And while we're out holding things together with sheer willpower and caffeine, Alina is breaking the law. We've filed unfair labor practice charges because they've refused to bargain in good faith. That's not just a bad look, it's a legal violation. This isn't just about stalling at the table, it's about an employer actively disrespecting our rights. That's why we took the step to voting to authorize a ULP strike. No one wants to walk off the job. But when leadership refuses to follow the law, refuses to even talk about safe staffing, and pushes nurses to their breaking point, we're left with no other choice. This vote is a message. We're not bluffing. We're united and we are serious. We are ready to strike if that's what it takes to protect our patients, our profession, and ourselves. Alina needs to remember, it's the workers who've kept these hospitals running. It's the nurses who show up day and night for people in those beds. We shouldn't have to march on the streets just to be treated with respect. But if that's what it takes, we'll be out there. We're calling on Alina to stop stalling, stop violating the law, and start bargaining seriously. Nurses deserve better. Patients deserve better. And we're not backing down.
Good morning. My name is Pam Whees. I'm a peri anesthesia nurse at Methodist Hospital. As you all know, yesterday we nurses gave our negotiating team the ability to call an unfair labor practice strike if needed because our employers are breaking the law by refusing to bargain with us in good faith. Our employers have had our contract proposal since mid-March, and not one facility has made a counter to our staffing proposal. In fact, they have all said they are simply not interested in discussing the safe nurse-to-patient ratios. This is incredibly disheartening to hear from those in leadership positions at our facilities. Ask yourself, why would leadership at a medical facility refuse to even consider safe ratios? Why do administrators fight against the nurses to prevent us from something that only helps our patients? They say it is because the economic toll of hiring staff would have a negative impact on the facilities. They say this while receiving tens of thousands of bonuses every single year. We nurses are fighting for this and other proposals in the hopes of bettering our contracts to bring new nurses to the bedside, keep our current nurses at the bedside, and ultimately so we can continue providing safe, compassionate patient care. I'm certain you will be hearing from them today about how we have unreasonable asks, but we are telling you what is actually happening inside our hospitals. Currently at Methodist, we have patients that are being treated in the hallways and the lobby of the emergency room. There are patients waiting in surgical recovery up to 10 hours, and cardiac patients receiving care in the hallways of our interventional radiology department. All of these patients are there because they are waiting for inpatient rooms. All of these patients are getting their treatment delayed due to these waits, and this can prolong the amount of time they need to be in the hospital. Not only do these waits prolong the patient's time in the hospital, but every additional patient added to a nurse's load increases the possibility of death and prolonged hospital stays by 16%. In my 13 years in healthcare, I have seen nurses be required to do more with less. This trend is not improving. Too many times I had patients apologize for needing my help to go to the bathroom or needing pain medications, stating, "You're so busy, I don't want to be a bother." No patient should know that we are short-staffed. No patient should ever feel like a bother or feel like they need to apologize to me while I am providing the care that they need. I transitioned from working as an aide to a nurse because the work is fulfilling. I'm able to provide care for those in need. Even on the hard days, I still love what I do. There were dark days of 7-to-1 patient ratios. I felt so disheartened because I was providing a bare minimum of care, and I knew it, and I knew that my patients deserved better. This type of work leads to burnout, and it leads to nurses leaving the bedside. I am speaking today because I care about my patients and my colleagues. I want to be part of creating an environment that makes people excited to pursue bedside nursing as a career.
Hello, my name is Joe Stiger, and I am a nurse at North Memorial Robbinsdale. After months of conversations with nurses, we've identified serious issues that affect our ability to provide quality patient care and are driving many nurses away from the bedside or out of the profession entirely. These are issues North Memorial leadership has refused to bargain on. Issues like workplace violence. This is still happening far too often, nurses shouldn't have to fear getting hurt so badly they can't work or worry about whether they'll make it home safely to their families. Health insurance. Nurses need to stay healthy for our families and our patients. Healthy nurses provide better care. It's just that simple. Staffing, it's not just about ratios. It's about getting breaks to eat, to use the bathroom, and being heard when we say an assignment is unsafe or unmanageable. North Memorial has told us they are not interested in bargaining over staffing, and that says a lot about where their priorities are. Fair pay and benefits. Nurses are at the bedside 24/7 from birth to death. CEOs and board members aren't. While hospital executives take home millions of dollars, some nurses are struggling to make ends meet. My personal breaking point came when I caught myself making excuses to leave patient rooms quickly because I had 5 other patients waiting for care. I wasn't avoiding the work. I simply didn't have the time to stay, and that time matters. Providing care isn't just about giving medications or checking vitals. It's listening, educating, reassuring. It's being present for your patients. That's the care that helps patients heal. When nurses are stretched too thin, that care disappears. Patients feel it, families feel it, and nurses feel it most of all. We're not asking for better staffing for ourselves. We're demanding it because every patient deserves the full care that nurses are trained to provide. And the hospital leadership has a responsibility to make that possible. By giving us the time, the staffing, and the resources to do our job safely and well. North Memorial says they're doing good enough on workplace violence, but that's not good enough when nurses are scared to come to work or are out for months recovering from injuries, like some of my coworkers. We've brought serious concerns to the table about staffing, safety, and workplace conditions that are directly affecting our ability to provide care for our patients. Leadership has refused to engage on these issues, and that's why we're voted to authorize a ULP strike, because North Memorial has refused to bargain in good faith over critical issues that impact patient care and nurse safety.